እንዲያ ስለሆነችብኝ ነው እንጂ ተኔ ተማጠኔ ወጣች አይደለች ተኔ ምን ይሻለኛል?
Her family hates her, which is why the family really leaves her with a little space next to the barn.
Because she's a cursed woman, as far as they're concerned.
Right, right, absolutely. She's no good to the family anymore. Her husband, abandoned her years ago, and she actually suffered with a fistula for 6 years before.
6 years of leaking urine.
And living in that little, hut next to the barn. Yeah.
You referenced the Nicholas Kristof article. I think it was in that article that I read that up until about a century ago, the obstetric fistula was so common in the United States that there was a major hospital, actually where the same places as the Waldorf Astoria stands right now, a major hospital just for treatment of obstetric fistula. So if obstetric fistula has been non-existent in the United States for close to a century, why are we hearing so much about it in Africa and parts of Asia and Latin America still?
It's really astounding. People are blown away by the thought that there was a fistula hospital in New York, even though so many people have never even heard about obstetric fistula. And the reason that it is such a problem in developing countries is that they don't have modern advanced medicine or hospitals. They don't have access to C-sections, to emergency obstetric care. So when a woman gets into a complicated labor where it needs treatment, where the baby is malpositioned and she needs help, she can't get any because oftentimes she's giving birth by herself, she's in a village, and if she's lucky she'll have a traditional birth attendant that's helping her, but there's no access to emergency care.
And the traditional birth attendant is probably not formally trained, is she?
Right. No. There's very few skilled birth attendants, even fewer midwives, and no surgeons. In Ethiopia alone, a population of 75 million people, there's only about 120 gynecologists. And most of those are located in the city, in Addis Ababa. So the rural areas are just, the women are getting no attention, and they're really on their own when it comes to giving birth. And unfortunately, that's also the case that we've found doing research around the world in other developing countries where there are a lack of doctors and there's a lack of hospitals. Another issue that causes obstetric fistula is early marriage. And their bodies are just too small to be able to handle a normal delivery. And of course, poverty and hard conditions growing up, having to take on a lot of work and not having a proper diet, which just causes their growth to be stunted. So they're just too small.
Yeah, Dr. Catherine Hamlin, the physician who basically started the Addis Ababa Fistula Hospital, refers to a loss of childhood.
Most peasant women in the developing world have to do all the hard work. They have to do the cooking, the grinding of the corn, the collecting of the water from the well, carrying sticks from the forest. So all her energy has gone into work instead of into growth. She hasn't had enough nourishment.
It's really tragic because it's a common practice in many countries in Africa and some countries in Asia to marry their daughters off young. And so a lot of girls will be married off at age 8, 9. IU was as well. She was married off at 8 years old, which means that their education is cut off. And so a lot of these women will be illiterate. They won't ever have the opportunity to go to school because they're married off so young. And in some areas, it's also a form of protection, that parents will want their daughters to be married off early so that they will not be kidnapped. One of our characters, Almez, was actually unmarried, and so she was kidnapped by a local boy and then forced into marriage. So it's a cultural practice that is being dealt with in Ethiopia. There is a law that the marriage age is 18, but there's more work to be done
to ensure that.
Yeah.
So essentially, what you're saying then is that obstetric fistula is totally preventable.
Yes.
But we're facing some medical issues and some cultural issues. What are some of the other causes of fistula?
Well, certainly infrastructure is key. If one of the doctors in the film, Dr. Ambai, says, if we tell these women to go to a hospital to get prenatal care, to get emergency obstetric care if needed, what can they do if there's no hospital to go to? And so sadly, that's the case for thousands, hundreds of thousands of women in the developing world where fistula is prevalent. They just don't have anywhere to go when complications arise. They don't have help, and they don't have a safe motherhood system in place. And so there are a number of organizations right now that are working to try to improve the infrastructure, improve prevention by bolstering safe motherhood practices.
Now, what do you mean by safe motherhood?
Well, for having someone like, for example, for having a midwife to be available in case a trained midwife that could help a woman that's in labor, that's stuck in labor, and actually the Fistula Hospital in Addis has opened up now a Hamlin Midwifery College to start training midwives that can then work in rural areas, so that if there are problems that arise, that they can be referred to some of the hospitals in the more major cities in Ethiopia. And
you said that there are some NGOs that are working to try to improve the situation in Ethiopia and I'm sure elsewhere. Do you want to tell us about some of these NGOs and what they are doing?
Sure. So the Fistula Foundation, which directly supports the Addis Ababa Fistula Hospital, has been increasing their support so that the Fistula Hospital can actually expand to rural areas. So they've opened up several satellite hospitals in the countryside. There's, I believe, 5 open now to date.
Really?
And yeah. And
in some of the major towns?
Yes, yes. And Mekelle up north, and Bahadar in the east, Harar in the west. So it really, it helps so that women don't have to travel quite so far to be able to receive treatment. And then what they hope to do with opening the midwifery school is to place these midwives in towns and health centers around the satellite hospitals so that they can help prevent fistula, but if they do find women with fistula, they can refer them to the hospital for treatment. Also, the UNFPA, the United Nations Population Fund, they have a campaign to end fistula, and they are working in over 44 countries where obstetric fistula is prevalent. So it also shows you how common it is. We don't know, a lot of people in the developing world don't know what obstetric fistula is, but it afflicts women in over 44 countries. So the UNFPA is working to support treatment centers, and they're helping with prevention efforts as well. And they have started also even training fistula advocates, so women that have had fistula that can then kind of share their story. So similar to what we were doing with the film, but I've gone to several global health conferences where I've actually met women that have had fistula that are speaking out about this tragedy and how it should not happen to them in this day and age.
And I think that the NGO that I've been affiliated with quite closely for a number of years, Engender Health is very involved in fistula.
Yes, and Engender Health has a fistula care program right now where they're also working in a number of different countries, and their efforts are supported by USAID, and they're also supporting the fistula hospital in Ethiopia and the satellite hospitals.
But through training of staff?
I think they're supporting the facilities themselves, and then I believe they also are supporting community outreach that's being done through IntraHealth.
The community outreach meaning?
Helping to mobilize